Sounds good. Thank you. So I guess I'll just start with introducing myself and then I'll share my poster. So let me make sure that
Oh
would you
yeah, let me
mind
get these.
enabling that? Thank you. Um, so hi, I'm Hannah Schaefer. I'm a junior majoring in public health sciences. I'm hoping to apply to medical school after I graduate. So this summer I'm going to be taking the MCAT. Um, I was a year off student last year, and last summer I worked with Caitlin, who many of you will probably know, on a manuscript for a paper that synthesized a lot of the findings that we came up with and a lot of the literature that she searched through um, in helping with the Michigan Medicine Project. And so that kind of leads into me talking about what project I was a part of. I was a part of the Michigan Medicine Care Continuum initiative, which was like a healthcare delivery redesign project. And so I will share with you my poster. Is everyone seeing this?
Yep, it's working.
Okay, sounds good. Thank you. So as I mentioned, I was part of this project, and the purpose of the Acute Care Research Unit's Michigan Medicine Care Continuum project was to utilize data-driven mixed method approaches to develop healthcare delivery redesign recommendations for the Michigan medicine system. This initiative included evaluating strategies, barriers, and approaches to improve care coordination and promote patient-centered care. This project focused on the acute care delivery in the Michigan medicine health system and community, including emergency, inpatient, ambulatory care. It also sought knowledge on the access, costs, utilization, transitions, and effectiveness of the care offered by the Michigan medicine health system. For the methods section, we used a variety of data for our project, including qualitative and quantitative. Our project was divided into 3 phases, so I'm going to kind of go through each of them for each of the various sections of my poster. For phase 1, we conducted an environmental scan to analyze the current state of the health system and community. There were 2 different advisory boards that were also put together, one consisting of patients and caregivers, and another made up of health system providers that were there to form and guide the project. Additionally, case studies highlighting care coordination and patient-centered care were analyzed. Michigan medicine healthcare system stakeholders and patient caregiver groups were also put together for information on their perspective. The existing quantitative data was also analyzed from the health system and collected, which included demographics on the patient population and healthcare utilization of the various settings in the health system, along with patient satisfaction surveys. There was also a qualitative analysis of 22 key informant interviews. And then we moved on to phase 2, which simply included 9 focus groups. And then phase 3, which was towards the end of my year up program, was the triangulation of the different data to compile the Michigan Medicine Healthcare Delivery Redesign recommendations. So basically, we took the data that we got and compiled it into recommendations that we had for the health system that they could either use or not use based on their thoughts on it. And then for the results, for phase 1, we have a figure that has the state of community health assessed during the time of the project, which included heart disease, cancer, and diabetes. The areas that we analyzed specifically were Washtenaw, Livingston, Wayne, and Oakland counties. Then we have figure 3, in which the key informant interviews are organized. Moving on to figure 4, we have the case studies that focus on interventions implemented in other health systems. So this is where I worked with Caitlin a lot on literature surrounding other health systems and what's worked for them, and then what we recommend for Michigan medicine. And then figure 5 is an analysis of the utilization data which revealed that ambulatory care was the department that was most utilized, which is really interesting for the health system in a sense that they know what of their services are being utilized and whether or not that means they should invest more in that system or invest more in other systems. And then figure 6 is the environmental scan that determined the access to various social determinants of health, again, in Washtenaw, Livingston, Wayne, and Oakland County. And then figure 7 is the last one from phase 1, and it again included our patient satisfaction data. For phase 2, again, the 9 focus groups here are summarized. The specific question that was asked is, what would you guess are the top 5 complaints about Michigan medicine? And so we asked all of them that question and kind of went where they wanted with that conversation. And then phase 3, again, is forming the recommendations. So our phase 1 indicated that the health system was lacking in care coordination and patient-centered care. This phase also found that other health systems such as Kaiser, Geisinger, St. Joseph Mercy, Mayo Clinic, Cleveland Clinic, and etc. have published reports on successful interventions to improve their issues in their health systems that we could also use at Michigan Medicine. Key informant interviews identified barriers to care coordination, including inconsistent patient care across providers and inadequate staffing for care coordination. The recommendations that we put together were offered by the key informant interviews, which included hiring social work managers and implementing complex care management programs. Phase 1 also included the utilization data, which shows that the health system, that ambulatory care, that was the care delivery setting that was used most by our health system, which is the case for a lot of health systems. Into phase 2, we identified many specific issues and complaints with the Michigan Medicine Health System from patients and caregivers that were expressed during the focus groups. This was where our qualitative data played a big role. And that kind of led into phase 3, which incorporated the quantitative and qualitative data into recommendations for the health system. So in conclusion, the Michigan Medicine Care Continuum Initiative project used a variety of methods to qualitative and quantitatively assess the barriers and approaches to improve care coordination and to promote patient-centered care with a specific focus on the acute care delivery in Michigan Medicine Health System. This project also identified that the health system was lacking in areas such as care coordination and patient-centered care, and it offered solutions through the literature, the successful interventions at other health systems, and the key informant and focus group interviews that we held at Michigan Medicine. This project also identified the top patient concerns, which is also very important for Michigan Medicine to know. That kind of concludes my poster presentation, but I'll leave it up for a while. And then moving into like kind of some tips and tricks from my own experience in Europe. I think that like a helpful resource for making my project was the Michigan Medicine project itself. So I was like throughout my Europe, which I'm guessing is similar to you guys, I was like directly working on the project itself. So that kind of helped lead to my poster. But another tip I have is like I didn't ever copy a table from the project itself just because like I didn't think that people in Europe that didn't have the context of the project would exactly know what the tables meant or stood for. So I kind of altered them in a way that it presented the data to someone that didn't know the project as a whole. And then like Wilson and Caitlin were great resources for editing my poster, and Sydney and Rama listened to me practice my presentation several times. I would say one challenge I had was I was a Europe student during the switch to online. So as you can see from my poster, like some of the things are like pretty small, which I don't really know what the formatting of your guys's will be. But if this was a poster in the original symposium for Europe, this would have been like legible. But as you can see, it's a little difficult to read like the focus groups. So I think that like if I had known that it would be a switch to online, I would have adjusted that accordingly. I also think that I struggled with like putting all the info on my poster. For example, like I had a very like dense background / introduction until I like narrowed it down to like some key factors. And so I think that that really like cleared out my poster a bit. And then to make the process more efficient, I recommend finishing your poster or like abstract as soon as possible. So then you have an opportunity to like take a step away from it and then come back to it to see if it like makes sense the second time or if it makes like as much sense the second time. If that's clear, like so that you have a second like fresh pair of eyes. And that's about it. Does anyone have any questions?
Could you zoom in on some of your figures?
Yeah.
Just so we could like see them a little bit more closely. And then it looks like a couple of them, did you make those like just as part of PowerPoint, or did you use a separate program to do it?
It depends. So I made several of these using like Excel or Google spreadsheets, and then I like just made them colorful and like match the theme of the poster, and then just like kind of screenshot it or like took a or like saved it as a PDF and then put it in here. But like this figure I made with Google Slides. This figure was made with Google. This was made with Google Sheets.
Did you go up to the beehive, beehive, I think it's figure 2.
Yes. So this one figure, is this one you mean?
Yeah, could you just go through that one and like in depth?
Yeah, this one was from the project actually. But so this is the key informant interviews. So we held 22 total interviews of like the key informant section. And so basically these are the different leaders that we felt had a say or input or like would have some good advice as to like how they've changed their health system. So we actually had some both from Michigan Medicine and like other health systems that we thought like would be able to give like good advice or like tell us the like failures or successes of different interventions.
Yeah, that's awesome. It seems like you have like a pretty good mix of like qualitative and quantitative figures. Do you have another like another quantitative figure which one's your favorite quantitative figure?
Quantitative, let's see. I really liked the patient satisfaction data just because it gave me a challenge because the way that it was set up for the project, they were a little like the way that the data was synthesized was a little bit different. So this is the one that I kind of struggled with the most, so that's why it's my favorite. But so basically like the data collected was different in the sense that like some of these were more specific towards like how the provider interacted with parents versus how the provider interacted with the patient based on like which one it is. So obviously the NICU and like peds was more with parents. And so like I kind of had to find a metric that like encompassed both of them. And then there was also like the way that the data was set up, like there was also different like questions, like study questions that were given to each of them kind of based on like where the focus group went. So I had to pick like a metric that was consistent for all of them, which was overall rating of care given, as opposed to like respect from physician, because I wasn't asked to all of the different departments. So it was valuable information for like Michigan Medicine, but for the purposes of the poster, it was kind of difficult to like explain all of that because you kind of just want one metric. Because this obviously isn't like a entire project or like the entirety of the project. And then this one I thought was a pretty. This one was a pretty sorry. This one was a very interesting, like this was my favorite like qualitative one, just based on the like it is quantitative, but I had to go through like the number of websites that like listed these resources, just because like as a public health major, this really is interesting to me.
Yeah, I think the figure is really interesting. Just thinking about how Washtenaw County is structured and like the number of healthcare resources that we do have, like just how it's like is almost more than double everything else. That makes a lot of sense.
Right.
With the reality, you can't really access that healthcare unless you have access to like all of these other things as well. So like a total oversaturation. It's really interesting.
Right.
Cool. So, and then overall, so did you build this in Google Slides or PowerPoint, or what program did you use to?
I built this in Google Slides, which I thought was very helpful because the fact that I have like all my different versions. So like whenever I would send it to like Wilson to help me edit it, he would never like change my slide. He would only like make a new slide of the same thing and then edit that so I could go back and forth. And I thought that was helpful.
Yeah, I think that's a good idea. So guys, when you're developing these posters, if you want to do it in Google Slides, we can do the same system as we're reviewing it, so you can see the different durations. Does anybody else have questions? I'm taking up all the question space, sorry. All right, well, thank you, Hannah, for presenting. Great poster, great presentation. Thanks for all the tips and tricks. I know you have a early class, so you might have to jet out a little bit early, but we appreciate you waking up and joining us this morning.
No problem.
Thank you, Hannah.
Thank you. This was super helpful.
Good luck on your posters, guys.
Great. All right, and Nasma, did you have anything that I see you joined us? Was there anything you wanted to discuss before we move on to Hannah Yoon's poster?
Nope, sounds good.
All right, sounds good. All right, Hannah Yoon.
Yes, I apologize for not being able to share my video. It wasn't working last night and I wasn't able to fix it by this morning.
Oh, no problem.
Yeah, but yes. Can you see my screen?
Yes,
yeah, it's like a little zoomed out. So like as you're going through it, can you just zoom into the different sections that you're talking about?
Sure. Can you still see it when I put it in full screen, or does it go into?
No, we can still see it.
Okay. Yeah, but I might not put it in full screen just so that I can make sure that I know where I'm zooming in.
No problem.
Yes. Okay. So I am Hannah. I was also able to join the ACRU team and the EPOC project through Europe last year. And currently I am a sophomore. My major is undecided, but I am anticipating a major in biochem, and I plan on applying to medical school after I graduate. So, right now I am still involved in EPOC and ACRU. But not through Europe because I left Europe, but I still wanted to be a part of the project. So I'm still there and I've been working since then, since my freshman year. So going into my poster presentation, the project that I was focusing on was basically like the best practices across the system of care for out-of-hospital cardiac arrest, more specifically a qualitative analysis of the chain of survival. And the title alone is just a very big topic. So hopefully going through the introduction will able to help you understand. So basically the project was focusing on out-of-hospital cardiac arrest, or OCA, because it only has a survival rate of about like 11%. And it's a very critical condition that we need to really work on throughout the US that we really haven't been able to develop. So there's like that development that we need to focus on, which is why this project was trying to get at that. So previous studies haven't really examined OCA response across the entire system of care, and they really didn't use the chain of survival as a framework to qualitatively analyze what goes well and what doesn't go well, the challenges at the level across the chain of survival. So we were trying to, through this project, find like the best practices for OCA response across the chain of survival and then validated it. So basically we were trying to use the chain of survival as a framework and then qualitatively analyze the system of care for the out-of-hospital cardiac arrest. And then by analyzing it, we were trying to find like the best practices for it. And the figure one, as you can see here, it's very small, but it's basically the chain of survival. The circles represent that, and then like the diagrams over it, or like the arrows and stuff over it, basically represent the system itself, and it talks about like what systems work at what stages of the chain of survival. So basically, moving on to the methods section. Those of you familiar with EPOC probably do understand the methods already. In this poster and project, I was able to describe what EPOC focused on to approach this method. So basically, we used the sequential mixed methods approach for the EPOC project. We took the Michigan Cardiac Arrest Registry to enhance survival cares data from 2014 to 2017 to examine the OCA survival outcomes across the Michigan Emergency Medical Service agencies. And we sampled 9 emergency medical service systems, which includes dispatch, fire, police, EMS, emergency departments, according to urbanicity, population density, and variation in survival rates. So I think we kind of went from like high survival rates to medium to low, and then from rural to suburban to urban, and it was like a whole. We took the 9 samples to try to get like a holistic data and view on the Michigan emergency medical service systems. So we conducted the key informant interviews and focus groups observations at each site, and through combined rapid and rigorous analysis, we analyzed the interview and focus group responses with a focus on the framework of system of care. And after that, we discussed the findings in groups to reach a consensus about the themes. At this point of my ERA project, the analysis was still underway, and we presented the primary preliminary results in this chart format. As you can see on the left here are the themes, and like I organized as the different varying links of the chain of survival on the left. So like link 1, recognition, and link 2, or link 1, activation, and then 2 was CPR, and link 3 was AED. And from the analysis, we were able to basically distill a theme for each of the links. And then we have some illustrative quotes that go with these themes that can portray it really well. So I will not be able to go through all the primary preliminary results, but I think I could cover a few of them right now. So for instance, in link 1, recognition, we were able to say that a big theme of that was that dispatch was utilizing protocol, which promotes getting key information from callers. And as you can see from the illustrative quotes, people will call and say a person is unconscious, and then once we get that someone's down, by the time the operator goes through this process, it's determined that the person is or has like a cardiac arrest. And that was from Site 4 by the dispatch mid-level manager. And in a similar way, we were able to talk about the themes and matching illustrative quote that went with it. So at the time, we weren't able to come up with like a full-on discussion section just because research was still continuing, and we weren't able to like come up with like a full discussion about things. So we were able to, from the results and the analysis that we had so far, determine that the first the links for the chain of survival were crucial for improving the response across the system of care, and that the final qualitative analysis will hopefully provide barriers or solutions that could be used to improve the OCA outcomes across the chain of survival. And with the analysis that we had, we concluded that the key factors from the qualitative analysis will be validated using surveys administered to the EMS agency and medical control authority directors across Michigan. And then through the surveys, we would be able to make a best practice toolkit developed for OCA response across the system of care, and then that would be distributed to all the emergency medical service systems across Michigan and nationally. Yes, and just a few acknowledgements. The study was funded by the National Heart, Lung, and Blood Institute, with data provided by the CARES Registry, and thanks to Dr. Rashid Kabir, Sydney, and all the other people that were able to help me for this year out project. That concludes my poster presentation. some resources that I used to develop the posters. To focus on the poster itself, the references down here that I included were mainly the references for the introduction to give like basic background information, which I try to summarize in like the first 2 bullet points. And then the next few bullet points, I try to focus on like the literature review, and to kind of explain what wasn't already in the literature right now and why the project was trying to focus on, and to like fill in the gaps in the literature. And then the data itself, like the primary preliminary results, was provided by the EPOC team and those who were doing the analysis, so that I could put in the incorporate the illustrative quotes into this poster. Outside of the poster, I was able to get a lot of help from Sydney, really. She was able to help me make sure that I was formatting things correctly, writing things out in the correct way, making sure that things were organized. I asked her a lot of questions and she helped me by responding to a lot of those that I had. And I could not have done this poster without all the illustrative quotes and the resources that the rest of the team also provided. With regards to problems that I had, because this was a qualitative analysis, it was really kind of difficult at first to make sure that I balanced like space and words in the poster. So I didn't want to like overcrowd the poster with like too many sentences and words. And I wanted to make sure that you could like look at it and still analyze or like see qualitative analysis results in like one, almost like a one look kind of feel. So I try to use the themes at the left so that you can only like read it in like a sentence, and then I bolded some parts of the illustrative quotes that would really highlight the themes there. Another kind of tip, but maybe also a problem for me, was the methods section. We had to use like action verbs for each of the bullet points because methods are like the things that you actually do and they're like action items. So I did not really understand or know this at first, so I was writing out full sentences for the methods section, which Sydney helped me fix through that. And the introduction was also a little bit difficult, trying to cut down on the words because the Europe project, the Europe system itself actually makes you, I don't know if they still do it, but they made us write out an introduction, and I was trying to break the paragraph into bullet points. Because I already had the paragraph, it was easier, but also difficult in a way because I was trying to cut out unnecessary words and stuff. And yeah, and just to make sure that I didn't have too many words, I also try to include images here and there. The little images, I'm not sure if you can see my cursor like that. If I have any suggestions to make the process more efficient, I think would definitely be talking with your mentor a lot, I feel. Cindy was really, really helpful throughout this entire development of the project for me. She was able to answer and get a lot of things like formats and stuff for me because I have never actually learned or like made a poster like this previously, and qualitative analysis was definitely not a thing that I've worked on before. So yeah. Oh, and she did share quite a few posters with me, like other than because I don't think Europe really provided it. Well, they did provide posters, but they weren't really like qualitative analysis posters. So Sydney was able to provide me some examples, which I was able to refer to, which helped me like format the headings and like the color distribution so that I could look at it in an easier way. I think that's all I have for now. If anyone has questions, I could try to answer them.
Hannah, how many different versions of the poster did you go through before you finally settled on like the formatting and the way that it was laid out?
The formatting, I actually didn't change much from the beginning. I think Sydney showed me like one poster that was used at a conference. I can't remember what it was exactly right now, but I kind of used that as a start off kind of thing. I guess the biggest change that I made was like making sure that I aligned things correctly so that I could fit all the information. But this kind of looked like what it looks like right now in the beginning in terms of format. But I did definitely go through a lot of versions to edit the content and stuff, and to make sure that I added figures as needed.
And when you presented this for the symposium, you presented this at the symposium, right?
I was also doing it at the same time as Hannah Schaefer, so I was doing this online.
Okay. Did you have any, like, I guess, like, challenging questions or anything asked of you?
Europe didn't actually, well, they weren't really able to like hold a symposium, so what they made us do was just like submit this poster.
Oh, okay.
Yeah.
Gotcha. That makes sense.
We presented
Right,
to like
doesn't-
Rama's team and Josh and
Yeah.
just the Europe team.
Did you guys have any like questions from them that like caught you off guard or anything like that?
I might be forgetting them right now at the moment, but I can't remember any right now.
Yeah, I mean, it was a while ago. I was curious. Okay. Jessica, Manuel, Gabby, any questions?
No questions at the moment, but thank you both for presenting. It definitely helped me get a better understanding of what I should be looking to do with Gabby on our presentation.
Yeah, I think Hannah also made a really good point about how I think Europe does really push you to like make it into a paper almost. I don't really know why they do that, but like most research that I've learned about since Europe and through my experience with like the ACRU team has shown me that like in real research like presentations they want you to like divide it up into bullet points, but for some reason Europe does push you to like kind of do it in sentences or in paragraphs. So I guess just keep that in mind when you're making your poster.
Yeah, and I just sent a link in the chat. I don't know if you can see it. Please let me know if you don't. But that is like the link for my poster that's actually on the ACRU website. I figured that if you can like look at it in more detail, it would probably help.
Awesome. Thank you both so much for presenting. Really appreciate you guys sharing your posters and your best practices. I hope the current trainees found it very helpful. It sounds like they did. For the current trainees, I just want to go over some due dates with you guys. So in order for us to provide the like best quality feedback on this process, can you guys see my screen?
We can see it.
Okay, so on Monday, so in order for us to like give you guys good feedback and help kind of format or help with the design of these posters, by 9 a.m. on Monday, we want you guys to have a combined draft of all the paragraphs you've written so far. So you did your intro, you did your methods, you did your result, you did your conclusions. For each poster project, we want you to have those all combined into one document, just so we kind of have like a high level overview of like how you're thinking about the project and we can make sure everything is like aligning well. We will use those papers to inform the presentation and the poster development, and also give you feedback regarding what figures might be most useful. So if you can get us those combined papers by 9 a.m. Monday, we will try to have some feedback regarding what figures to do by Tuesday. And then maybe 9 a.m. Wednesday is unreasonable. Maybe we should, I don't know, maybe like by Thursday morning, we'll say like 8 a.m. Thursday. I want you to have your figures drafted, or at least like, you know, your first passes at figures drafted. You know, you should have at least one figure on these posters, maybe two, depending on your project. So I really think it's important you guys get these combined papers done. So Sydney, Nessa, and I can give you ideas for like what figures you should be doing. And then after we've had a chance to look at those figures and we have a chance to look at those drafts, it'd be great if by like Friday night, you guys could have your poster drafted so we can look at it over the weekend and give you feedback on the overall project. Any questions about that? Looking forward to your weeks, does this seem like a reasonable timeline, or do you guys have like 3 exams next week that's going to make it hard to get this done? Knowing that the poster is due on the 30th. I guess Gabby and Jessica are the only 2 people on the call that this actually applies to. So, Jessica, any objections?
No, this seems okay with me.
Okay, Gabby, any objections?
No, it's good.
Okay, cool. All right. Well, I think that concludes today's training session. Thank you.